And of course, as you would know, that on the 10th of October, it was World Mental Health Day. So mental health is something that's very, very important, something that we cannot neglect, or rather talk about on the peripheries of main conversations that we ought to have. But it's something that is very, very important. It's something that determines whether you're going to do well in whatever it is that you do, or maybe you're not going to do well. So in studio, I've got Xoliso Msebele, who is, of course, from the Zimbabwe National Association for Mental Health. Good morning, Xoliso. How are you?
I'm good, thank you. Good morning, viewers.
Now, of course, taking a look at your name, my assumption is you come from the city of Queens and Kings and Queens. Is that so?
Yes, and I'm one of the queens.
Of course. Indeed, you're one of the queens and a champion in your own right, of course, of mental health.
Yes.
Right. Now, let's get straight into the conversation. World Mental Health Day was last Friday, like I alluded to that, of course. And tomorrow, and as an association, you're having an event. And now I want you to unpack to me that why is it important to commemorate this day for mental health?
Thank you for that question. Maybe I'll start also by giving you a brief of what is ZimNAM.
Right.
Zimbabwe National Association for Mental Health. This is an organization which was established long back, that is in 1981, right? And it was established for the purposes of promoting the rights of persons with mental health conditions.
Right.
And in 1985, this same organization, it established a center called Tirivanu Rehabilitation Center, which offers skills training, life skills training. It also empowers persons with mental health conditions so that they are able to live an independent life.
Okay.
Yes, so that's ZimNAM for us. Mm-hmm. And tomorrow, the 17th of October, we are celebrating this day in Chinamora, mm-hmm. Tomboshava. Mm-hmm. The theme for this year is access to services, mental health in catastrophes and emergencies. And this is the theme that we are promoting tomorrow. According to us as an organization, we're saying when it comes to issues to do with mental health, how accessible are the services to persons with mental health conditions? Okay. Yes. All right. We want to understand that. Mm. So tomorrow we'll see us bringing different stakeholders, mm-hmm. including the government, okay. NGOs, the communities at large, mm-hmm. The leaders, the community leaders as well, where we want to learn from each other. Mm-hmm. We want to raise awareness so that we begin to change the narrative mm-hmm. when it comes to issues to do with mental health conditions.
Right. Now, I want you to talk to me about, you almost did preempt my next question. Of course, I would want to know, and I'm pretty sure the viewers want to know, what will be happening in Tomboshava in terms of the program, the activities that will be happening there. You've alluded to some of the people or some of the institutions that are invited. We also want to know what, who is invited. Are there any surprises? What sort of activities will be taking place in Tomboshava as well?
Oh, okay. A lot of activities are planned for the day. Mm-hmm. We'll begin with a march, right? March is more of saying, hey, there's mental health conditions. Awareness. Yes. So let's know more about the condition. And then the stakeholders, they'll also give some speeches. We'll have also persons with lived experiences when it comes to mental health conditions, so that we appreciate and begin to think in other terms, right? And some of the organizations, they will also showcase their services so that we know who are the service providers when it comes to issues to do with mental health condition. And by doing that, we are saying to the communities out there, let's not take mental health issue as just a problem. Mm-hmm. Let's take it as a condition which can be cured, mm-hmm. which can be managed if we seek professional help.
Right, if we seek professional help. Now, let's come, I think, to the most important question that there is to this conversation. When we talk mental health, what is it exactly? Can you unpack to us, what is mental health exactly?
Mental health is a condition which is triggered by a lot of factors. So I would say we can talk of environmental factors like trauma, mm-hmm. right? This can be due to physical and emotional abuse. We can talk of biological factors. This can be issues maybe to do with family history or genetics. And also expecting mothers and menopause due to those mood swings. Mm-hmm. They do contribute to mental health conditions. And we also have substance abuse, mm-hmm. the abuse of alcohol and drugs.
Right.
It's also another factor which exacerbate mental health conditions.
Right. I want to maybe to ask you this, because I've heard people talk about it when they're conversing, socially, that those people who talk alone, talk to themselves, they talk alone, or rather, some say they are thinking aloud. In street lingo, antaura ega. Is that a mental, is that a symptom of something that is not right mentally with that person?
That's a symptom. And when we see whether it's a friend, it's a colleague, it's a relative behaving like that, we need to offer support. We need to take that individual to the professionals, health professionals, mm-hmm. yes, so that we are assisted, we are guided on what to do, so that that person at the end of the day enjoys his or her rights.
Right.
Yes.
I asked that question because to some colleagues, they would say, yeah, it's normal to talk. They call it thinking aloud. From talking that I need to go to A and B and C and do that. So from there, I'll go to what? And I'm actually having a conversation with myself.
Those are the signs. We need help. And you may also need to know that World Health Organization statistics, it's saying 1 in 8 persons lives with a mental health condition. So this shows us how serious this condition is. Yes, some may be talking alone, some may be laughing alone, some may be screaming alone. Those are the factors, and we need to take them serious.
Right.
Yes.
Okay. Now, of course, in your line of work, what are some of maybe if I can ask you to mention 2 of the foremost, uttermost driving mental health issues?
It's tricky to say this and this,
right?
Because these factors, they are intertwined, okay. So to speak. You can see somebody drowning himself or herself in alcohol. We need to understand why. We need to take that person back. Why are you behaving like this? Okay. It could be stress related. Emanating from financial problems, relationships problems, So it's really difficult to point it out. We need to sit down with the person, understand why he's behaving differently.
Right. And of course, now you did talk about substance abuse. Now we've seen a rise in drug and substance abuse issues that are, of course, related to mental health. The question is, I think at this point it's an assumption, but drug and substance abuse, is it something that is related to mental health issues?
Yes, it's related. It's related. I can give maybe example of some of the drugs. We can talk of cocaine. We can talk of marijuana. We can talk of alcohol, right? And we're saying all these drugs, they have implications when it comes to triggering our depression, anxiety, as well as the mood swings. Right? And these three, they are the tenets of mental health conditions.
Right.
Yes.
All right.
If somebody is depressed, it's an indication that something is not well. And the more that person consumes alcohol, the more the levels of depression.
Right. So you talk about depression, which happens sometimes. You talk about maybe some of the things that can contribute to mental health, that being trauma, relationship problems. The list is endless. Now, what are some of the interventions or solutions to mental health, to those issues, to make sure that mentally one is okay?
We need to speak out. I'm saying we because all of us are involved, and we need to be involved, because issues to do with mental health, they do not favor gender. It can happen to either females or males. So we have a role as a society. We need to be good listeners. And when we observe certain changes, let's not rub it off. Let's lend a hand. Let's discuss. Even in churches, let's preach about mental health from a human rights perspective, right? So that it gives me confidence to come out in the open and tell you that I have a problem, right? We also have to bring this out even in homes. Let's talk about it in a free space. These are some of the interventions that we can do within our reach. And then maybe when it comes to the government, we would say we would need support when it comes to raising awareness, right? And also reach out to rural areas. We also need support from the government in terms of funding, because mental health conditions, we can only make a difference if we attach that to budget.
Right.
Yes. So we would need support also from the government in that area, and we would need also the continuous access to medication and services, because we're saying somebody with a mental health condition, it can be managed through medication.
Right. Thank you so much, ma'am, for coming to the show, and all the best in your event tomorrow. And thank you so much for furnishing us with information as far as mental health is concerned, so that we know how to check ourselves and how to keep ourselves regulated, and as far as mental health is concerned.